Hey everyone, today I'll be talking about a reproductive disorder called uterine fibroids. So, what is uterine fibroid? Fibroids are benign tumors that appear in a woman's uterus during the time a woman could bear a child. Another name given to uterine fibroids is leiomyomas. There are different types of uterine fibroids which are classified depending on their location. So, intramural fibroids are located right here. And then we have submucosal. This picture doesn't show submucosal fibroid, but you would see them protruding right here and on this area of the uterus wall. There's also subserosal. The picture shows two of them here, one right here, and then another right here. And then the picture doesn't provide it, but there's also pedunculated fibroids, which would appear hanging in this cavity, or even like right here outside hanging from the uterus. And then we see some right here above. These would be considered fundulous because this is the fundus, right? Okay, and then sometimes a person can have just one, and sometimes they have multiple. In this picture, you can see there's many of them. All right, next slide. Okay, so these bumps, they can vary in sizes. The picture to the left, I think it's a really good reference of how big these masses can get. It can be as small as a apple seed, like from right here, and then they can grow up to the size of a grapefruit or like this lemon, and then they can even grow up to the size of a watermelon right here. When these masses are on the larger scale, you can actually see these protrude from your belly. In that case, this affects the surrounding organs, and then it can cause many other problems, which I'll go over in a bit. Okay, so let's talk about the symptoms now. So I want to mention that when we start discussing what types of symptoms a patient can experience, notice that a lot of these can be tied together. So like, for example, right here, someone may experience very heavy periods every month. And then like a lot of times they may also experience like spotting or irregular bleeding in the middle of their cycles. So these heavy bleedings, they don't allow the body to replace its blood normally. And then in return, it can cause anemia, which is shown right here. Anemia is a sign that your body is experiencing deficiency in nutrients. And then with anemia, it's not mentioned here, but anemia can also cause signs of brittle nails, hair loss, migraines, and dizziness. Another symptom shown in this picture is chewing ice, which I thought it was interesting. And once again, that is also caused by anemia. When you're low on iron and other nutrients, sometimes the body, it can crave ice, clay, chalk, mud. This is called pica. Pica is when your body craves things that don't have nutritional value. So other signs are shown here, which is pain during intercourse, extra body weight. Remember that these masses, they can be very large sometimes. Like, for example, remember we saw the picture of how big they can be. They can be as big as a watermelon, and then, well, that can add to your weight. Another sign is a need to urinate frequently, constipation and bloating, and then infertility. If a couple is trying to have a baby, sometimes these fibroids can push against and then constrict the fallopian tubes. This can make fertilization difficult to achieve for some couples, but then again, some women are still able to get pregnant, and then they can have normal pregnancies while having them, but sometimes they may cause the risk of miscarriages or the need for a cesarean birth. Okay, let's talk about the causes and risk factors. So we have genetic factors right here. Your genes, they can determine if you'll experience this. So if your mother or your sister have these fibroids, then it is more likely you will probably have them too. We also have extra weight, which we just talked about in the last slide. Vitamin D deficiency, and then there's also there have been many studies that have shown that African American women are more likely to experience this. We also have birth control as a risk factor. I am sure you girls know that there's so many side effects when it comes to these medications, so you should talk to your doctor or gynecologist about what type of contraception would be best for you. Birth control pills, they contain estrogen and progesterone. Remember, we learned that estrogen is our fertility hormone. Everybody's different, but sometimes estrogen in high levels, they can lead to the development of these fibroids. And then if your body doesn't secrete enough progesterone, then the body can't stop the growth or limit the size of these fibroids as well. Okay, next slide. Diagnosis. So usually a lot of women are not aware they have these fibroids, and then doctors sometimes accidentally discover them during pelvic exams. Another way to be diagnosed is to have an ultrasound. Here's a video of what a uterine fibroid would look like. And then I also provided a picture of this mass right here shown in the ultrasound. That's the fibroid. So another way is having lab work done. Usually someone who has anemia will have blood tests done to determine what is causing their deficiency. And then in return, they will eventually find that they have these fibroids. Treatment. Okay, so we have medications like gonadotropin-releasing hormone. What this does is it blocks production of estrogen and progesterone. And then this can sort of cause like a menopause in females. And then it causes them to stop menstruating. And then when they stop menstruating, their anemia improves as well. And then we also have MRI-guided ultrasound surgery. So during the ultrasound, they can find the exact location of the fibroids. We saw this in the video I provided. And then they can use this technique called sonication, which is basically using sun waves to heat up the mass, and then it destroys the tissue. We also have another treatment called uterine artery embolization. So this requires an injection of some agents that stop blood flow to these fibroids. And then, if you stop blood flow, then you can cause them to either shrink or then the tissue to die. And then the last treatment I put is hysteroscopic myectomy. So this is a procedure that can be done if the location of the fibroid is in the submucosal. Remember the first picture I provided? I went over the different locations that can be found in. And so an instrument is then put into the vagina and then into the cervix, and then they can be surgically removed. That concludes my presentation. Thank you for listening.